Hello, my name is Jora Jang. I'm the Chief of Staff and Equity at Worksafe, and I'm recording this presentation on the Emergency Temporary Standard in January of 2022. Thank you for joining us. We're an Oakland-based organization, and we work to prevent worker illness, injury, and death by bringing justice to the workplace. One of the many ways that we do that is by petitioning for and pushing for standards that increase protections for workers. I'm going to talk about one of those standards today. That is the Emergency Temporary Standard. Oh, here's the slide for me, who I am, and my email if anyone wants to contact me. So I'm going to talk today about the standard. The dates of the standard that I'm talking about go to April 2022. This rule went into effect in November of 2020, and it is a moving target. There's constant meetings and talks going on, and so what was in the standard when it first passed and what is on it now and what may be in the future may change a lot, and so it's really important to stay up to date with what's going on. And you could do that by just tuning into Worksafe and our various meetings on it, and or just contacting me or tuning into our website to find out more. So I'm gonna what I'm covering today is just a snapshot of what's gonna exist until April of 2022, and then at that point we're going to go to a third readoption, which was just authorized by the governor, and and at that point some of the provisions I talk about today may change. So just to be aware of that. So who is covered? Just as a beginning, nothing in this section or this the ETS is intended to limit more protective or stringent state or local health department mandates or guidances. There are provisions within the ETS that try to take into account changes by CDPH, for example. And so it's kind of designed to be a little flexible, but it also at the same time has been criticized to be rigid in some of their requirements. And so if there is a stronger or more protective guidance out there, that is what we want employers to follow. So this standard applies to all workplaces with some large exceptions. So employees covered by the ATD standard does not apply to those, as well as employees working at home or teleworking and employees who are not in contact with others. So there are several requirements in this standard which I'll go through, but some of the really main features that are important include a system for communicating about COVID-19, which is fully implemented, and it contains some of these following elements. You want to make sure that the employers have a system that allows employees to report COVID-19 exposure and status, if they have COVID-19, as well as possible close contacts with other employees or employers who are on the site as well, without the fear of retaliation for reporting that they have COVID or that someone they worked in close contact with has tested positive. The communication system should describe how employees with medical and other conditions that put them at increased risk of severe COVID illness can request accommodation for that. Also want to inform employees of what are the identified COVID-19 workplace hazards and how to get COVID testing. And policies and procedures that the employer has around COVID-19 should be communicated to employee as well. In addition to how the employer is going to notify or let people know when there are COVID exposures in the workplace. The prevention plan should also have a response for outbreaks. The employer has to make, for example, in an outbreak, the employer has to make COVID testing available to all employees in an exposed group. It doesn't matter what your vaccination status is, you should still be able to get testing. And testing must be available free and at no cost. There are also other provisions regarding employer-provided housing and transportation, which I'm not going to cover today. So what are some of the things that are required under the ETS? So I'm going to go through some of these. site-specific prevention measures. One is screening, which you all are probably familiar with right now, and that involves some kind of process to ensure that employees coming into the work site are being screened for potential symptoms. Also, provision of face coverings. For all employees who are not fully vaccinated, the employers must provide face coverings and ensure that they are worn when indoors or in vehicles. Employees who cannot wear face coverings due to medical or mental health condition or disability, or who are hearing impaired or communicating with a hearing impaired person are exempted from this. For those who are employers should try to make as much outdoor air as possible. For those employees that cannot wear a face covering, or they're doing some kind of task, or wearing a face covering is difficult, some alternative should be worn, such as a face shield. All right, let's go to the next one. Ventilation. I kind of brought this up already, but maximizing outdoor air as much as possible if there's good AQI. But also ensuring that the site is ventilated as much as possible, so that you don't have the air kind of sitting dead with potential exposure in the air. Sanitation, as you all know, is an important feature. This includes cleaning procedures for commonly touched areas, and also during high risk exposure periods, and I'm going to define what that is in a future slide, so just keep that in mind. So when it's high exposure risk periods, there should be really good protocols around cleaning. Employers also need to allow time for hygiene. That is, what's the point of saying you have to wash your hands and you have to, engage in hygiene, but then you don't allow employees the rest and breaks that they need in order to do that, nor the hand sanitizer or whatever, soap, in bathrooms. Those kind of things are a must. Employers should provide PPE that may be useful or applicable. In this case, gloves, eye protection, respirators for voluntary use, such as N95s, are some examples of PPE. Testing, we've kind of gone through that already, but I'll go into more detail in a minute about it. And physical distancing as well, especially if there is a major outbreak. The ETS also requires training and instruction. The employer has to provide effective training and instruction, and this might include the employer's COVID-19 policies and procedures to protect employees, and how to participate in identifying and evaluating COVID-19 hazards. The training should also include information regarding COVID-19 related benefits to which the employees may be entitled under applicable federal, state, and local laws. Some of those benefits are covered in the ETS. Some are covered under leave laws and other areas. The fact that COVID-19, so the training should include the fact that COVID-19 is an infectious disease that can be spread through the air. When an infectious person talks or vocalizes, sneezes, or coughs or exhales, so therefore the ETS has some specific guidelines about what exactly should be in these trainings, and the fact that the particles containing the virus can travel more than 6 feet, especially indoors. So the training itself has to kind of include these very specific science-based information on this, as well as vaccines. The employer's policies for providing respirators, and the right of employees who are not fully vaccinated to request a respirator for voluntary use. And in this case, when I'm talking about respirators, I'm talking about the N95 mask. If respirators are provided by the employer has to train on how to properly wear the respirator and how to perform a seal check around the N95 to ensure that the manufacturer's instructions each time a respirator is put on is actually following the manufacturer's instructions. The training should also talk about the importance of frequent hand washing, the proper use of face coverings. In addition, the ETS also provides provisions on how to investigate and respond to exposures. And let's go into that in a little bit more detail. These are just 4 short points, but I'm actually going to go into it in more detail because I think This is an area where a lot of workers are really concerned because something has happened and they're like, well, I didn't see the employer doing all the things that I think they should do. So what are the things that employers should do under the ETS? So first thing is they need to determine when the COVID-19 case was last in the workplace. So if possible, this can include finding out the date of the testing and the onset of symptoms. They need to determine which employees may have been exposed to COVID-19 through close contact. Again, I'm about to explain what close contact means, so you got a couple of words and phrases here that I need to define in a moment. They need to notify employees in writing if any potential exposures within one business day, and this includes employers as well who are on site. So I don't know if you have experienced this, but I definitely have as a parent. In receiving, really detailed notifications right away within a day by email and or text of exposures in the work site, in this case, a school, So make COVID testing available to potentially expose employees with close contact for free. And for free, meaning that also includes like at no cost with respect to their pay. And we're going to go a little bit into exclusion pay in a little bit. And or testing, the ability to be able to go test without losing pay. With the exception of asymptomatic employees who are fully vaccinated before the close contact, and for a limited period, those employees who are just recovering from COVID-19. So making COVID testing available to those is not a requirement. The employer needs to exclude COVID-19 cases and expose employees from the workplaces until they are no longer an infection risk. Up until this week, that exclusion period was 10 days, and now it is 5 days. Just so you guys know, we'll go into that in a little bit of detail as well. They need to investigate the exposure, whether workplace conditions could have contributed to the risk of exposure, and what corrections should reduce exposure. So let's talk a little bit about some of these definitions. What do I mean by close contact? A close contact is being within 6 feet of a COVID case for a cumulative total of 15 minutes or longer during any 24-hour period during the case high-risk exposure period. So then the next question, what is the high-risk exposure period? So there's two different definitions for this. So for someone who has tested positive but never developed symptoms, the high-risk exposure period is 2 days before until 5 days after the first positive test. The second is for cases who develop symptoms 2 days prior until 5 days after symptoms appear and 24 hours since the last fever. So, really specific here about when these high-risk exposure periods are. And when I referenced it, it was for testing purposes and sanitizing purposes. What is fully vaccinated? An employer has documented the person received the final dose of an FDA or a WHO approved vaccine at least 14 days ago. So those are some definitions. The employer also needs to maintain certain records to document their COVID prevention plan and its implementation. This includes reporting known COVID-19 cases at the worksite to the state and local health department, records of the steps taken to implement the written COVID-19 prevention program. They need to track all COVID cases in the worksite and make available data that is like where personal information is redacted or de-identified to workers and the union. And they need to continue following long-standing Cal OSHA requirements for reporting serious occupational injuries, illnesses, or death, recording work injuries and illnesses on the Cal OSHA log 300s, and pursuant to their own IAPP, maintaining records of worksite inspections, hazard correction, and safety-related training. One of the most reported citations is for employers who fail to do this. So, all right, let's talk about testing. So, an employer needs to make testing available at no cost to employees who have had a close contact with a person with COVID-19, and in the case of multiple infections or a major outbreak, make testing available at no cost on a regular basis for employees in the exposed work area. This requirement does not apply to exposed employees who are fully vaccinated and have no symptoms, except if there's a major outbreak. So how the employee can obtain testing for COVID-19 can be at the work site or at a place outside of the work site that is free. they need to make the testing available to potentially expose employees in such a way where the employees are not receiving, they continue to receive pay, basically. They're not having to do it on their own time. That is particularly important. So I've talked a little bit about this, so let's talk about exclusion pay, and I hope that your employer is providing this. But what is exclusion pay? Once again, just to remind you, within 1 business day of the time that the employer knew or should have known of a COVID-19 case, the employer needs to give written notice in a form the employees can understand that there may have been exposure on the work site. And then the employers need to ensure that that COVID-19 case is excluded from the workplace until certain return to work requirements are met. So employees who have had a close contact are excluded from work until the return to work requirements are met, except for employees who are fully vaccinated before the close contact and who do not develop COVID-19 symptoms, and COVID-19 cases who are recovering. Basically, the return to work right now, it used to be 10 days of quarantine. Now it's closed down to 5 days. During this time, the employer must continue to provide pay and must continue to provide job protection for those employees that remain. So who is excluded from work? This is, let's get into the details of this. So 2 groups of workers are to be excluded from the workplace until return to work criteria are met. This includes vaccinated and unvaccinated workers with symptoms. So I'm talking about people with symptoms. So they have, these are people who have had a known COVID case, a positive test, or workers who have had a close contact with somebody who was a positive case. So those groups of people need to be excluded. People who do not need to be excluded are those who are symptom-free, vaccinated workers. Employees who were previously excluded from the workplace for testing positive are not subject to close contact exclusion for a period of 90 days as well. So when can workers return to work? So if a worker is asymptomatic, that is, they tested positive, but they have no symptoms, they must remain out of work for at least 5 days since their first positive COVID-19 test. If you're symptomatic, there are more stringent requirements if you're symptomatic, because there's a concern that you could infect other people. So if you're symptomatic, you can return after these conditions are met. At least 24 hours have passed since you've had a fever of 104 or more, and you didn't take some kind of fever-reducing medication. Your COVID-19 symptoms have improved, and at least 5 days have passed since COVID-19 symptoms have appeared. If they have had a close contact with somebody who is COVID-19 positive, they can return when, if they are asymptomatic, they've remained out for at least 5 days since the close contact. If they have some symptoms, they can return if they have a negative PCR test that was taken after the onset of their symptoms, at least 5 days have passed since the last known contact, close contact, and they were symptom-free for at least 24 hours without the use of fever-reducing medication. What are the pay and benefit protections that employers must maintain? These include earnings and wages must be paid at a regular rate of pay, seniority, rights and benefits, and rights to their former job status. I know this has been a tricky area for people during the pandemic, but under the ETS, this is what the law currently says. If your employer has a paid sick leave policy that is separate and in addition to the paid sick leave policy required by the California law, California's paid sick leave law, your employer can require that you use that separate sick leave if you had to stay out. So exceptions to exclusion pay. Some exceptions exist if the employee is unable to work for reasons unrelated to possible COVID transmission, and the company demonstrates that the COVID-19 exposure was not work-related. So, for example, you got it from some other location, maybe a child at school got it and gave it to you, something like that. There are notice requirements as well. AB 685 requires employers to give notice of potential COVID-19 exposures to all employees and independent contractors, and ETS requires the employer to notice any other employers in the workplace So we'll talk about this in a little bit, but we want to make sure that unions are able to use the ETS to the best of their ability to continue to support workers in the workplace. And some of the ways to do this are to kind of scrutinize the workplace, making sure that the employer is engaging in all the legal requirements, and once again, knowing that these legal requirements are kind of moving and changing. And making sure that preventative measures are in place, making sure that those people who are excluded are getting paid, and that they're returning to the job that they left, meaning nothing happened in terms of no adverse employment actions took place while they were away. They didn't get laid off, demoted, moved somewhere else. So I've talked a lot about how it used to be 10 days and now it's 5 days. And this is because of new isolation and quarantine guidance that was provided recently from the governor's executive order. So it's really kind of important to stay abreast of the different, the kind of changing landscape of this. The governor just recently, I believe it was just a week ago, issued an order that the 10 days is now down to 5 days. This is based on current guidelines. And that's why you see that all throughout the requirements for the ETS, exclusion pay is now reduced to 5 days. Okay, so what's next? I've already talked about the Governor Newsom's executive order. We have a possible third readoption coming up of the ETS in April until 2023. At that point, exclusion pay, which I've covered, may be at risk. So please stay tuned. We may let you know whether or not we'll need you to come out and talk about your workers' experience. Recently, supplemental sick leave, which was slated to expire September 30th, 2021, has been brought back. On January 25th, 2022, Governor Newsom and the California legislative leaders announced that employers are required to provide supplemental sick leave again. Specifically, California employers must provide up to 80 hours of COVID-19 related paid sick leave through September 2022. This will retroactively apply to COVID-19 absences from January 1 to 2022. This situation is evolving, so we recommend that you visit the DIR website for updates on this. In addition, there are multiple avenues for protected leave, and I would recommend that you go to Legal Aid at Work. They have a great fact sheet that you can review. There's also a really great link to a multilingual questionnaire in which you can enter questions about your current situation, and answers will pop out that will give you information for the leave, and we will provide the link to that in the slides. Again, thank you so much for joining me today. I look forward to continue to work with you, especially in pushing for the ETS and making it as strong as possible. Thank you for all that you do for California's workers.